Good afternoon. It is my honor to be here and to have Daraleigh here. Is the microphone working for us? Hey, do you want to say hi and see if your microphone's working?
Hello.
All right. So, Daraleigh, would you mind just starting by telling us a little bit about your family? How many kids do you have? How old they are?
Well, my name's Daraleigh O'Watch. I'm 41, and I have 8 children. My oldest is 24, and my youngest is 16 months.
And it was when you were pregnant and ready to deliver your beautiful baby, your youngest baby, Alana, that I had the opportunity to meet you.
Yes.
And you shared your story about anemia through your pregnancies, and specifically that one, and how it changed your life. And I'm so thankful that you're here to share with us your story.
Thank you.
So when was the first time that somebody told you you might be low on iron or iron deficient?
I was 16, pregnant with my first child. I was low on blood, and I was sluggish, and they gave me the pills, and they didn't help. Didn't help at all. I gave birth to my son, and I went to the States a week after he was born, thinking I was okay. I hemorrhaged. I had to be rushed back up to Saskatchewan here. My womb wouldn't close, and I kept losing more blood. So they put me back on pills. Didn't help. Didn't help at all. I was sluggish, lethargic. My mom had to wake me up to feed my child because I was breastfeeding. I couldn't even function. I couldn't talk. I couldn't even go back to school. How bad it was. So I was always overwhelmed and tired.
Wow. And then through your next 6 pregnancies, before your last one, did anybody say anything to you about being low on iron, or did anybody give you any treatment?
No. They always prescribed pills, the Materna pills, the iron pills. Nothing helped. Nothing brought up my iron. I was always low, pale, had no energy.
Did you have any side effects from the iron pills that you were prescribed?
They hurt my stomach, and it was constipation. And they didn't prescribe anything to help with either.
So they gave you a prescription that wasn't helpful, that caused side effects?
No.
And they didn't address the side
Nothing.
effects? So tell me what was different with your most recent pregnancy.
Well, I was about 3 months into my pregnancy, and I got all my blood work, and the doctor said, your blood's not changing. He had prescribed to me iron pills, and my hemoglobin wasn't going up. Nothing was helping. He tested me at 3 months, and he couldn't believe I was functioning because I was at a 54.
Hemoglobin 54. That's crazy. These lab techs, they know what that means. And you were a mom of 7 kids.
Yeah, I'm running a household, so I don't have time to be sluggish, lethargic, whatever. I had to function, and so I did the best I could. So he got me into the lab right away, the iron fusion lab. Within a few days, I went there, and within 24 hours, I had energy. I was able to get up with my children. I was able to function. I was able to talk. I didn't have that pregnancy brain, where you're forgetful and everything. I didn't have it as bad, but it was still there. The color in my skin came up. My appetite came up. I just had energy that I never had for the longest time, or ever had. So it was good. It was awesome. It was like being Wonder Woman or Superwoman, And at the time, my son was like 4 years old, so I was getting up and walking him to school. I didn't have to get his brothers to go and walk him to school. I was getting up. I was doing all the extra things that a mother should be doing instead of having my children help me. So my house was clean within a few days.
When we were visiting at lunch last week, you were sharing a bit about some symptoms that you had that you thought might be depression. would you mind sharing a bit about those symptoms and how they changed?
Okay, after I had my son, that's like 6 years ago, I went into depression. I already knew my blood was low. Every pregnancy was low, but not as low as this last pregnancy. And I started getting anxiety, and I would get tested, but it was always my blood was low. They're like, and I thought I was going crazy. I was having anxiety attacks. There was a few suicidal moments where, I was thinking of self-harm. I plunged myself into the bottle because I didn't know how to cope with the anxiety. It helped me sleep at night. So I was almost losing myself. I was on the verge of a breakdown. And then when I got these iron infusions, even while I was pregnant with my daughter, those 3 months were awful because I was having anxiety, waking up in the middle of the night, cold sweats, not wanting to sleep, can't eat. And then when I did sleep, it was like I slept and slept and slept. So when I got this iron infusion, my anxiety went right down to non-existent. I was just telling her, I can't remember when's the last time I had an anxiety attack. I don't have those emotions, like, wanting to self-harm, or I just don't have no depression. Nothing whatsoever. I'm happy. Like my children have a happy mom, so I'm happy.
I'm so happy for you. Thank you for sharing that part of your story too.
You're welcome.
So after you gave birth to Alana, did you notice any changes with the postpartum recovery?
Actually, the only thing I experienced was the emptiness. Any woman knows, like, after you have a baby, you have that emptiness. And that was only for about maybe a week, 2 weeks. And I had no postpartum, nothing serious. Not like how my last pregnancies were, where I was like depressed, I guess. Where I wanted to self-harm again, where I just wanted to drink, where I didn't want to do anything but hide myself in my bedroom and not cope. Well, this time it was like totally different. It was like, just strange. After going through all those pregnancies with that bad postpartum, and then having this pregnancy and no postpartum, so everything was just strange and new and nice.
And nice.
Nice.
No postpartum depression is nice.
Yes.
I'm so glad that was your experience at
Yes.
this time. Did you notice any differences with breastfeeding this time?
Yeah, my daughter got chubby really quick. She got everything. She got all the nutrients she needed. She wasn't lacking. I didn't have to substitute. She was just straight on breast milk.
Cool. Do you notice any other differences about your daughter compared to your other kids?
Yeah, with my other children, with all my other pregnancies, I had to stay in a hospital for anywhere from 2 weeks to 10 days because of how low my blood was. Well, I had my baby on a Friday and I was out Sunday. Nothing wrong with her. She had no jaundice. She was the only baby out of all the bunch that had jaundice. Had no jaundice.
No jaundice.
And she was very vibrant and thriving. So it was good. It was really good to be home after, 2.5, 3 days of giving birth. It was nice. It was the first time. And I still had energy. I had lots of energy because before I left the hospital, they made sure they pumped me twice with iron. And then, so I had all that energy.
Fill up your iron tank before you go home.
So I had all that energy, and it was good. Like, it was like I didn't have a baby. I wasn't sluggish. I was cleaning house again,
Yeah, that's cool. And you were sharing with me that now you also have energy to give back to your community. Would you share with
us
about that?
I just started teaching beading at the Thompson Community School here. I teach grades 6, 7, 8 how to bead poppies. Before that, if I didn't have this iron treatment, I wouldn't be doing anything. I'd be sitting in my room crying, hiding from the world and that. But because it has changed my life, I have this energy that I can share, teach, go to these activities with my children. I wouldn't want to do that before.
Fantastic. Can you tell us a little bit about your experience going for the iron infusions?
Well, that was like a struggle in itself because I lived way in the south end in Hisdale, and to get to that clinic was a hassle because, like, you don't have the money to go. Like, it's like $20 a cab to get from one end to the other, then back. So it was like $40 to get to the clinic. And then you don't want to travel on the bus because you have to start off 2 hours early. And when you're feeling as low as I did, you don't want to be around people. You don't want to look at people. You don't want people to look at you. So it was a struggle to get there and back. But when I got there, the women were awesome. Like,
the nurses?
The nurses. They were very friendly, welcoming, accommodating. So I never had a bad experience there. Not really.
That's great. Did you have any side effects or bad experiences with the iron infusion itself?
Well, just one, and it wasn't really bad. It was just that they were pumping the iron into me faster because I usually would sit there for an hour and a half to almost 2 hours. They were trying to pump it into me for an hour, within an hour, and it gave me a sore stomach. And then when they slowed down the drip, it went away. I was good. That was the only problem I had with it.
And you had a number of infusions, like kind of every month, almost for a year?
Right from, right from, I think, January, or was it December? December I started, right up until this past May.
Wow. Is there anything, looking back on your experience with anemia, low iron, since you were 16, is there anything you wish we had done better as healthcare providers?
More testing, more options. More testing and more options would be,
How do you think IV iron could help people in your community?
Oh, it would help a great. It would help lots. I couldn't find a word. Anyways, it would help lots because I really believe that iron deficiency is linked to depression and suicide. It would help lots with the teens, the young girls, the young boys that are coming of age. Their bodies are changing. They would need that iron. I think it would prevent a lot of suicide, a lot of depression, a lot of misconception of it.
Mm-hmm. Your story of how IV iron changed your life is so inspiring. Thank you for sharing your story. Would it be okay if some of our friends asked you some questions?
Sure.
Does anybody have any questions for our local IV iron champion?
Is this going to be a lifelong thing?
Maybe for me, because I'm always low on iron. My body doesn't produce enough iron, so if it is, then I'm fine with it because I like to have that extra energy. I'm good for it. Pardon me? Yeah, I love a clean house, but I have teenagers, so, I got to wait until they're gone to university to clean, so I'm good.
A home care scenario where a nurse comes over and teaches the therapies.
Wow.
I would think so. I would hope so.
We need to look into that.
Yeah, I would definitely. That'd be something to do. Yes.
In past pregnancies, were you transfused?
None. This is my first pregnancy that I was transfused in.
Or that you got it.
You mean the iron transfusion? Oh, no,
No blood
nothing.
transfusion.
No blood.
I'm just curious if it's because iron therapy is a newer treatment that it would have been
I think so, yes. Because I didn't know nothing about iron infusion until Dr. Osanya prescribed it to me. No, it didn't. It would have been.
I can speak to that a little bit as an obstetrician. Only 2 years ago did I learn that IV iron was a solution, it was an option. And so if I had patients that I have that have similar stories to Daraleigh, they would say, yeah, I saw Dr. Lett and she gave me iron pills. Until 2 years ago, we didn't recognize that this treatment that has been available for a long time, actually we should be using in pregnancy.
But I have to tell you that 30 years ago, we saw anaphylaxis lots with IV iron. So the new stuff is different than the old stuff, and old users like me get on board with the new stuff. Be careful of the old stuff.
Thank you, Dr. Harding.
I have a question. How frequent are you using the IV iron now in the last 2 years?
I use it a lot more commonly than I ever did. In terms of my practice, the most common place I'm using it is for postpartum hemorrhage on the mother-baby unit, because I have ease of access for it there. Initially, we had good access for IV iron at the infusion clinic, but we can't, our demand has exceeded their capacity, and so now pregnant patients aren't able to access IV iron there. The other place that I'm using IV iron is in my ladies with hemorrhagic periods and anemia as a result, so I use hormones to stop their bleeding and iron instead of blood transfusion to bring their hemoglobin up to normal. I'm not actually sure what is covered on the formulary, but what the evidence would suggest is that if you are iron deficient but not anemic, you should try oral iron, and 8 weeks later your ferritin should be more than 40 if you're not pregnant or 30 if you are pregnant, and if it's not, you failed oral iron, and anytime you fail oral iron, you should get IV iron. Well, Daraleigh, thank you so much for sharing your story with us. You inspire me. Thank you.
You're welcome.